Testes, also known as vrishank in Hindi, are located in the scrotum and are part of the male reproductive system. Testicular cancer or vrishank cancer is the abnormal growth of cells in the testes resulting in the formation of a lump which can spread to other parts of the body. Testicular cancer often presents as painless swelling in the testicles that can be detected through self-examination. Apart from this, there is not much pain in testicular cancer. Testicular pain occurs when the testicular mass becomes large or has bleeding in it, causing a dull ache that patients may ignore. Symptoms come when testicular cancer spreads to other parts of the body such as cough when it spreads to the lungs, and bony pain when it spreads in the bones, etc. So testicular cancer usually occurs in younger patients. This kind of cancer is found in the late teens, 20s and 30s. It has some risk factors, in which the first risk factor is cryptorchidism. Cryptorchidism occurs when the testis, which usually resides in the scrotum, is instead located in the abdomen or inguinal canal, increasing the risk of testicular cancer. Apart from this, there are some other risk factors such as having a family history of testicular cancer. If someone has testicular cancer in one of its testes, the risk of developing it in the other testis increases. It has also been seen that infertile patients have more chances of getting testicular cancer. In particular, there are not many ways to avoid this. The only thing we should do is to do a self-examination. And if you feel that your testes are increasing in size for a while, then you should immediately consult a doctor. Testicular cancer can be diagnosed easily and accurately through ultrasound screening, which can detect lumps inside the testis with great precision, making it an ideal method for this type of cancer. When a tumor is found, there are some blood tests which are protein markers, particularly for testicular cancer, such as alpha-fetoprotein, beta-HCG and LDA. There are 3 markers which are used to indicate the presence of testicular cancer. A rise in their level suggests the potential diagnosis of testicular cancer. In addition, these markers can also help determine the type of cancer that the patient has. The help of CT scan can also be taken to know whether there is any lump in the stomach or not, which has reached the stomach arising from testicular cancer. Biopsy is vital for understanding. It guides evaluation and treatment decisions in the diagnostic process. In testicular cancer, we should not do a biopsy directly from the scrotum. Due to alterations in tumor cell drainage, the testicular mass may extend into the scrotum skin and beyond. Hence, diligent monitoring becomes crucial to prevent the spread of tumor cells. It is treatable. If the cancer is only present in the testis, a procedure of high inguinal orchiectomy is performed. The surgery removes the testis through an incision made in the lower abdomen. This is used as primary treatment option. If the disease is localized in the testis, the complete diagnosis and appropriate treatment can be determined based on the type of cancer cells. After surgery, protein markers and blood tests are repeated in a few weeks to evaluate the patient's response. If the markers normalize, the patient undergoes follow-up for monitoring and care for consistent progress assessment and support. If those markers are high or it is found in the CT scan that there are lumps in the stomach, then the help of chemotherapy or radiation therapy is taken. We should also remember this is mostly found in young males who may be unmarried. So we should also do sperm cryopreservation with the objective of preserving viable options for the future, which can be useful later. So, our tea is over. But remember, self-test your testes and know your nuts.